COVID-19 recovery, helping Hoosiers recover financially, physically, mentally, and socially through services provided by Community Action of Greater Indianapolis. Services include energy assistance, child care, family support, education, training programs, transitional housing, and food assistance. COVID-19 recovery.
Hi, I'm Kelly Vaughn, and welcome to COVID-19 Recovery. And we're focused on helping you recover through this pandemic. And I understand that the vaccination rates nationally are at about, Al, you said what, 70%?
70% fully vaccinated for adults.
Okay, so Al Bracken, who is the co-host here from Community Action of Greater Indianapolis. And so we've got a lot in store for you on the show today, right, Al?
Right. Good morning. This is Al Bracken with Community Action. Thank you, Kelly. Kelly, just in case you have to take a pause, we will go ahead and talk to our guests here in a few minutes. But I wanted to thank Kelly for all she does with Community Action and what she does in producing various shows throughout the year, throughout the last year explicitly for COVID relief. Her voice has really meant a lot. And I personally know from the feedback that we get in the community that she is participating in helping to save lives for folks that are getting the vaccine. So thanks, Kelly. I wanted you to hear that before you paused.
Thank you.
Yeah, because that's real.
Okay.
Having said that, Community Action of Greater Indianapolis, and I've said this several times, through the CARES Act, started a program, Community Pandemic Wellness Initiative. And one of the smarter things that we did as an organization is went outside of our organization to a consultant that has very much been doing a lot of things in the community, actually not only in Indiana or Indianapolis or in South Bend, but around the country. And that is Leroy King. And Leroy, you've been on this show before, but that seems like years ago. Kind of reintroduce yourself and tell us about LK3 and what you are doing with Community Action and the CPWI program.
Yeah, well, thank you, Al. Again, thank you, Kelly, as well for having me on today. Again, my name is Leroy King, and I'm the CEO and owner of LK3 Consulting. And to put it in a few words, we help institutions, employers, not-for-profits, community initiatives, help solve people engagement problems. So we really try to help organizations beef up what they do, improve what they do so that they can engage their constituents, whether they're employees or whether just people in the community, a lot more equitably. So we do a lot of diversity training as well, awareness training, as well as community mobilization initiatives. So that's why this project just seemed to be really in our sweet spot, so to speak. So I want to thank CAGI as well as the director Terrence for the confidence that you all have put in me for being able to lead this project. Very worthwhile and rewarding project. And it's been an honor to serve alongside you, the board, Terrence, and the many people that we've been able to partner with to bring this project to the Indianapolis community.
Outstanding. And I would remind our audience that, again, the CPWI is the approach that we decided to take. We wanted to take a holistic approach to looking at COVID relief. And in that, we're doing a wellness initiative that we've been engaged in for about 11 to 12 months now. And that initiative is a mind, body, and soul perspective on how we're looking at health disparities and the COVID relief. One of the things, one of the aspects of that, the soul part of our initiative is working with pastors throughout Indy.
Yeah.
And Leroy has designed, as part of this initiative, a program along with Pastor Farr of Overcoming Church, an outstanding program that we've been able to capture a lot of the ministers that have joined our group. We've been able to work with a lot of congregations. So Leroy, can you give us an update with that and talk a little bit about, since you've been on here several years ago, can you tell us a little bit about what you've been doing with the pastors and where we're at and how that's looking? And let's talk about outcomes. Let's talk about progress.
Yes. Well, again, I think one of the smartest things we've done is to bring Pastors Bruce and Loretta Farr on board to help lead this initiative as pastoral liaisons. One of the things that we knew from the beginning is that we wanted to mobilize grassroots people, grassroots leadership, people who are already trusted in the community. And as you stated, as part of our soul element, the spiritual element of CPWI, it was very critical for us to reach out to pastors and to engage their congregations because they're in the communities. Right? They're already there. They're already considered trusted entities within the communities. So as we set out to start this conversation, basically, we wanted to educate pastors and provide pastors with resources that they then can take to their congregations. And we know that pastors are going through a lot through this pandemic, from having to bury people who have died to dealing with families. Some are weren't able to meet for a long time, and so pastors needed the support system that we wanted to provide. So we started out and we got a list of pastors who are interested. So far, we have about 20 representing churches, pastors that are participating in this, what we call the roundtable, the Pastoral Health and Wellness Roundtable. We started in August, and we meet every 2 weeks, and we have conversations around everything involving health and wellness, especially around the overall health issues that our communities, specifically with African Americans and Latino communities, are facing. But also we have very frank conversations about the vaccine as well. So one of the things that the pastors wanted to do was to make sure that there was a solidarity between the pastors. And so in October, they declared October to be, let's make that a wellness month. And I think it started before October, and there were some events even after October. But the idea was that their activities and things that they would do at their churches would be focused around health and wellness. They know, as a lot of us know, that when we talk about the gospel, and it talks about salvation, it's just not talking about the spirit man, it's talking about the whole man. So they really wanted to bring information and knowledge and education to their congregation on how to be well, how to live well, how to be safe. And so the churches have stepped up. We've had about 8 various events that have taken place, whether it's through education, health and wellness fairs, workshops, a number of things, vaccinations. People are getting vaccinated. So we have been very pleased, and that's just the beginning of some things that they will be initiating.
Outstanding. And one of the several things that Leroy just touched on is the activities that went down in October. And it's really fascinating to look at this from a grassroots perspective, because we started out doing health and wellness. And we're going to continue to do health and wellness. But, and in that, we looked at health disparities as it relates to chronic conditions such as COPD, asthma, hypertension, and diabetes. But what that really has morphed into, it has gone to be an initiative to get folks just to go to the doctor. We had to go back to basics, because as we started to do these health fairs, we started to ask a simple question: when is the last, because when we do the screenings, we started to ask a simple question: when is the last time you actually were seen or been to a physician? When's the last time, or a provider, when's the last time you had a physical? And that question has been very enlightening, where one person hadn't seen a physician in 50 years, 50. The average person that, as we look at this initiative, had not gone to the doctor in 3 years. And we do a lot in geriatrics. So what's your feedback on that, Leroy?
Yeah, it's really amazing how people, for various reasons, are not seeing the doctor. So having this conversation and being able to have people encourage them. I believe, I think I remember one of our health wellness initiatives, we had someone came and their sugar was about 190, or even higher than that. Another individual, their blood pressure was through the roof, and we were able to connect them to their primary care physician. If they didn't have one, we were able to through our partners, solidify some health to allow them to be able to really have some follow-up and get the medication they need, get the care that they need. And sometimes people just need someone who would be there to just have that talk and that encouragement that we need this, and we need to follow up on this. And I think a lot of times people they're busy, I don't want to mess with that, or I really don't understand that. So if we create a community where people are coming alongside folks in our community and being able to hold their hands in some ways to go to the doctor, to whatever, I think we're going to have a better outcome from health outcomes, and people are going to be more engaged. And that's what this is really, the CPWI, the Community Pandemic Wellness Initiative, at its core is really to make sure we create a safe space to have conversation, and create the community that people need to help support them in making the right decisions for their bodies.
Outstanding. I couldn't agree more. One of the sayings that we have adopted, we stole it from Homeland Security, is if you see something, say something.
Yeah.
So that goes along the line. If you see somebody, or somebody that needs to go to the doctor, if you see somebody or somebody that's not getting their prescription medications, say something.
Yes.
Right now we're working through the churches, and all of the pastors that we are working with, every single one that we've encountered, they have the mission. Their ministries are to look after every single member of the congregation. So we would encourage everyone that if you know somebody that does not, that they're not seeing the doctor or a nurse practitioner, all you have to do in most cases is say something. Because a lot of the referrals that we get when we are in community centers or churches is from other community members or other church members that are identifying somebody that has not been to the doctor. So having said that, we're going to go ahead and take a quick break and come back and talk to Leroy about some of his endeavors, his hub concept of community service. So with that, we will be back shortly.
During the COVID-19 emergency, community action agencies are open and here to ensure the well-being of families across the country. For over 50 years, we've been delivering life-changing services, solutions, and stability.
Contact your local community action agency serving Boone, Hamilton, Hendricks, and Marion counties for help during the COVID-19 emergency. We can assist with masks, hand sanitizers, food, shelter, transportation, and more. Apply today.
Welcome back. We have Leroy King, the owner and president of LK3 Consulting, with us today, this morning. And when we left for break, Leroy, we were going to talk about your concept that you brought to CAGI and the CPWI about the hub concept of community service. And I really want Leroy to touch on this because when he initially explained this to me, it made a lot of sense. And as we see the program grow, we can envision, CAGI can envision implementing this moving forward. So talk a little bit about your hub concept of how you designed the program for the CPWI initiative.
Well, initially what we have done was identify vulnerable communities that were negatively impacted by COVID-19, and specifically African American and Latino communities. One of the things that we know, that I know, is that typically when we have conversations regarding health and wellness, life, and especially health and wellness, those conversations take place outside of these communities. Right? The community typically don't have a whole lot of voice in what happens, with their life. They're not really part of the discussion other than through focus type of surveys and different things of that nature. So the idea with the hub was, let's bring health and wellness really into the community. How can we mobilize and engage people at the grassroots level in neighborhoods? We knew that we will have to initiate organizations such as churches and community centers that have already been in the community. And we said, well, if we create these hubs where people can connect with, they can walk to in some ways. And these hubs can be the center of kind of the launching pad of a lot of health and wellness initiative, things that will improve people's quality of life. Number one, we increase people engagement because there's a trust factor that's already baked in. But secondly, people will have access. They won't have to have a car to access the local church that is near them, where they can participate. So that's where the hub concept came from. Through those hub concepts, we use that to create networks and leverage community partners. Sometimes those hub events will be large events that are neighborhood centered. Right? They're not events to bring in the whole city, so to speak, but is very targeted in those neighborhoods. And so that was the whole idea of the hub concept.
I think you just said something that's really key that explains the success rates that we're having, is the targeted organizations, targeted populations. And when we're doing these programs with community centers or even with churches, we really are targeting the congregations and the members in the immediate vicinity of these community centers. And without trying to affect the change or change the whole city at one point, instead of doing 3 large events, our goal is to do 30 or 40 smaller events.
Yes.
And in that, we, in the last year, just talk a little bit about some of the activities that we've had and some of the outcomes that have been produced in a relatively short period of time.
Yeah, I started writing down some of these things and I realized, oh, this is why I'm tired. And so
Yeah.
we've been busy, and it has been a good busy. Um, this year alone, from what I can gather, we've had at least 50 plus events that we've done this year. We just launched in the first quarter of this year. And so we already, have a lot of events that we've been doing, and it continues to grow. We've directly impacted over 1,000 people, indirectly maybe 5,000 plus. And then because of social media and various other connections, we probably have 10,000 plus that have viewed our content in one way or the other. We've worked with and engaged with about 60 partners, and we've vaccinated 135 people. And so now, Al, you would appreciate this. We've given away 5,500 masks, at least 5,500 masks, and almost 2,000 hand sanitizers. So we've been really busy. But I want to emphasize too is the activities are important, but they're really for us to build trust and to engage in a bigger conversation and to mobilize our community. So it's just been an amazing experience that I've had and many in our community are having.
I would absolutely echo that 100%. And I would just, while we have enough time, I would just personally, again, like to thank Leroy and professionally thank him, because it's opened my eyes up to a couple of different things. And within the group of pastors that we have engaged with international churches. One of the churches is based out of, not based out of Haiti, but the larger part of their congregation is from Haiti. And another one of our churches, a larger part of their congregation is based out of the Congo, Kenya, and Nigeria. And going to both of these churches, it was the first time that I have participated and been involved with a church service that was not spoken in English at all. I mean, none, but it was absolutely spiritual, fascinating, and life-changing. And what that has done for the CPWI program and CAGI, well, the CPWI program, it's kind of led us to look at some of the issues that involve refugees. And we've looked at and participated in another church, a third international church, that has a lot of a heavy Muslim population from Afghanistan, from some of the refugees coming from Afghanistan. And as long as we have interpreters, now that's the key issue. As long as we have interpreters when we're trying to communicate a health and wellness message, there's a lot of good that we can do. And we appreciate the journeys that these folks have gone through. Again, that's Afghanistan, Haiti, and the Congo. We just did here recently a program at New Jerusalem out at 38th, near 38th and Midhofer. And I, as part of the learning curve, I had no idea that area had such a high Haiti refugee population.
Wow.
And being involved with this program has really opened my eyes personally and professionally and spiritually to be able to help some individuals that really, really need it. Yeah. So that's a long-winded segue. I just wanted to say that, Leroy. So I wanted to get your feedback on that and how you see us moving forward in the future with these very special churches.
Yeah. From my understanding, did we have 33 get vaccinated at
Yes,
New Jerusalem?
correct.
And you know, it's just amazing. I see what we're doing now is it's really planting a seed. And it's a seed of empowerment. It's a seed of people taking control of their own destiny and control of their health and wellness. And what we want to do is come behind them and help support that initiative. And so I think we're only seeing a small portion of what's going to happen. I really believe that people are going to, you know, communities are going to become more engaged around this issue. And I think communities, especially since there's such a great need in the Haitian community and as well as the Congo community, we're going to see there's going to be a rallying around that. And so we want to come alongside and say, how can we support and, you know, not take control, but how can we support their efforts to live well, to be healthy? Yeah.
Well, so, okay, we've got a little bit of time left. Now to tell everyone how to get in contact with you, Leroy, and what your future plans look like.
Yeah. Well, if you're interested in being part of the Pastoral Roundtable, or you want to connect with us in any way to engage in this conversation and to have local mobilization to see how we can work together, you can contact a couple of things. Contact us at info@cpwind.com or cpwind@gmail.com. You can email those two addresses, as well as you can email me directly at Leroy@lk3consulting.com. Leroy@lk3consulting.com. And go to our website, cpwind.com, and you would find those contact information there as well a lot of the activities and events that we're participating in.
Okay. Thanks, Leroy. That is going to be the end of our show for today, our program for today. I'm sure next quarter we'll bring you back and get another update, and we'll look forward to hearing about all the great activities that you're doing and the CPWI is anticipating.
Great. Well, thanks for having me.
All right.
Yeah,
thank you.
Thanks for having me.